Patrick has been diagnosed with COPD and left-sided heart failure, both of which are contributing to his respiratory symptoms of dyspnea and irregular cough. Left-sided heart failure is a condition that occurs when the heart becomes too weak to effectively generate enough cardiac output to supply the vital tissues. In turn, the fluid levels build up in the pulmonary circuit, leading to pulmonary edema, and the lungs are unable to provide adequate oxygen to the body, leading to shortness of breath. The conditions which cause COPD, such as chronic bronchitis and emphysema, result in an irritation and damage to the airway and alveoli in the lungs. This damage can include reduced elastic recoil that prevents oxygen from being fully released before the next breath is drawn in, leading to shortness of breath. More damage occurs when the alveoli septa, which reduces the effectiveness of gas exchange. A ventilation-perfusion mismatch occurs, causing hypoxemia and shortness of breath. COPD also causes inflammation and bronchial edema. This increases the number of mucus cells which produce thick mucus that cannot be cleared due to ciliary dysfunction. Together, the swelling and excess mucus can cause the airways to become narrower. This leads to Patrick's regular cough, which is his body trying to excrete the excess mucus. Patrick's heart rate is 155 beats per minute, which is therefore considered tachycardic. The factors within Patrick's life that may have contributed to his elevated heart rate include his modifiable risk factors, such as an unhealthy lifestyle, stress, and his unmodifiable risk factors such as age, his gender, and his genetic history. The most detrimental factor would be his smoking history. Patrick has smoked for 40 years and has only stopped at age 60, which has caused ongoing inflammation to the airway epithelium. Once the airway becomes inflamed, the immune system releases inflammatory cells, which cause both continuous bronchial irritation and inflammation, as well as the breakdown of elastic tissue within the lung, which leads to his productive cough and shortness of breath. These factors have led to his comorbidities of COPD and LSHF, which have also contributed to his elevated heart rate. COPD is defined as a progressive chronic disease characterized by irreversible obstruction of the airways. It can consist of two diseases, emphysema and chronic bronchitis. The single most common cause of COPD is smoking. Patrick has smoked for 40 years and has only stopped at age 60, which has caused his ongoing inflammation to the airway epithelium and the breakdown of his elastic tissue. The left heart failure is caused by the inability of the left side of the heart to generate enough cardiac output to meet the oxygen demand of his body. Patrick experienced a myocardial infarction to his left coronary artery when he was 68 years old. After an MI, the myocytes receive decreased or no blood flow, as the artery has been blocked. This leads to a cardiac cell death within the left ventricle. The cells don't regenerate, and a non-contractile fibrous scar replaces these cells. This means that contractility is decreased due to these dead fibrotic or abnormal myocytes, leading to decreased cardiac output. A decreased CO causes the body to adapt through the ventricular remodeling and activation of the RAS system to try and compensate for the dead cells. These compensatory measures cause ventricular enlargement, less contractility, and an increase in blood volume, which continues to decrease the cardiac output. Hypertension is the other leading cause of left-sided heart failure. Patrick's blood pressure is elevated at 138/85. Therefore, this is an increase in peripheral vascular resistance, which creates an increased workload to the left ventricle, stimulating myocardial hypertrophy and reduced contractility. Ultimately, the hypertrophied and fibrosed myocardium is no longer able to maintain normal cardiac output, and the left ventricle fails. Patrick is exhibiting signs of metabolic syndrome with a waist circumference greater than 102 centimeters, reduced HDL, raised triglycerides, raised BP, and raised plasma glucose. This can be associated with heart failure. COPD and left-sided heart failure do not have a causal relationship, but they are known to exacerbate each other. When blood is not oxygenating sufficiently due to COPD, extra stress is placed on the heart, which worsens the symptoms of left-sided heart failure. With left-sided heart failure, excess fluid builds up in the lungs from blood accumulating in the pulmonary circulation, as it is unable to be pumped out of the ventricles. This causes pulmonary edema, which can exacerbate COPD symptoms, as it reduces the ability of the lungs to exchange gases. Right-sided heart failure usually occurs as a result of the left-sided heart failure which Patrick has been diagnosed with and is experiencing worsening symptoms of. When the left ventricle fails, blood pools in the pulmonary circulation, resulting in an increased pulmonary pressure. This increased pressure increases the resistance to the right ventricular emptying. The right side of the heart attempts to compensate for this, however, it is unable to cope with the increased afterload, which then puts stress on the right ventricle, which dilates and fails, therefore leading to right-sided heart failure. Blood accumulates in the veins, which causes swelling in the legs, which Patrick is also experiencing. COPD can also contribute to right-sided heart failure. COPD reduces the amount of oxygen in the alveoli, which causes pulmonary hypoxia, leading to vasoconstriction of the pulmonary system. This causes pulmonary hypertension, leading to an increased workload of the right ventricle, which progressively hypertrophies and dilates, and over time reduces its cardiac output, possibly causing right-sided heart failure. Therefore, Patrick is at risk of developing right-sided heart failure. Patrick's sodium levels are high, therefore indicating hypertremia. This is usually the result of dehydration due to low fluid intake or possibly hypoperfusion of the kidneys, which leads to the RAS system retaining water and salt. This could result in feeling of thirst, disorientation, confusion, and a risk of seizures. Patrick's glucose levels are elevated, therefore possibly indicating an impaired glucose intolerance. This could be the result of his poor diet, inactivity, excess weight, and may be an indicator of type 2 diabetes. It could result in blurred vision, brain cell damage, memory loss, and cognitive impairment. Patrick's potassium levels are high, indicating hyperkalemia. This could be the result of a reduced glomerular filtration rate and pharmacological treatment of his heart failure. Hyperkalemia can affect the membrane potential's depolarization in the sympathetic nervous system, which can lead to a decrease in speed conduction. Tiredness or weakness, numbness, tingling, nausea, chest pain, and an irregular heartbeat can result. Patrick's hemoglobin levels are low, indicating anemia. This could be due to his poor diet, resulting in iron deficiency, his age, or his impaired kidney function. This could result in fatigue, weakness, dizziness, and/or shortness of breath. Patrick's calcium levels are low, indicating hypocalcemia. This could be due to his poor diet and also his indicated poor kidney function, leading to calcium being excreted through the urine. This could result in muscle cramps, confusion, memory loss, and tingling sensations. Patrick's high triglyceride and LDL levels and low HDL levels could be the result of his poor diet and sedentary lifestyle. This can result in atherosclerosis and plaque formation due to a buildup of LDL in the arteries, leading to possible blockage of blood flow that could result in heart attack or stroke. Cholesterol levels may have an effect on Patrick's learning ability and memory loss. One additional blood test that could be taken would be for his brain uretic peptide levels. BNP levels are a simple and objective measure of cardiac function. This test can be taken to show if Patrick's left-sided heart failure has worsened. It can give the doctor a guide as to which treatments he will need and to look into what the future may hold in terms of his condition. BNP is a peptide hormone that is secreted in the heart's ventricles in response to stretching caused by increased ventricular blood volume. Its function is to promote urine excretion, relax blood vessels, lower blood pressure, and reduce the heart's workload to ultimately protect the heart from stress. The levels of BNP in your blood rise when heart failure is present and reduce when heart failure improves. Therefore, Patrick is expected to have high levels of BNP as he is being diagnosed with worsening left-sided heart failure. The myocardial infarction Patrick experienced would have led to ventricular dilation, making the cardiomyocytes detect stretch, which therefore leads to the secretion of BNP.